for the meeting of the New York City Health and Hospital Equity, Diversity, and Inclusion Committee. Today's meeting is officially called to order. Please note for the record, Dr. Zahira McNatt is representing Dr. Michelle Moss, and Karen St. Hilaire is representing Molly Wasso Park, both in voting capacity. Next on the agenda, I would like to propose a motion to adopt the minutes of the Equity, Diversity, and Inclusion Committee meeting held on September 10th, 2024. Dr. Katz?
So moved.
Thank you.
Yes.
Yes, thank you. Dr. Katz? Yes.
Yes.
Jackie Rowe Adams?
Yes.
Karen St. Hilaire?
Yes.
And Dr. Zahira McNutt?
Yes.
And myself, yes. Next is a diversity and inclusion update from Evelise Mendez Justiniano.
Good afternoon, everyone. So today I will be presenting on our progress with equity training, language access, our veteran symposiums, disability awareness, LGBTQ+, worker equity, followed by some informational sessions. And that will be followed by a presentation from our equity and access team, our diversity subgroup with Dr. Davis and Dr. Belay. So we'll begin with our education and capacity building. These are all the equity trainings that we've held for calendar year 2024. Our a total of 86,743 participants system-wide were trained in all areas of diversity, equity, and inclusion. Our top two trainings were sexual harassment prevention training, and identifying and managing unconscious bias. In terms of language access, we completed the RFP for interpretation services. Happy to announce that the new contracts all started on November 1st. We have over the phone and video remote interpretation, on-site interpretation for spoken languages, on-site interpretation for sign languages, and language proficiency and interpreter skills assessment. We now have one primary vendor for OPI and BRI, with brand new iPads we delivered to all of our facilities. And the iPads are bright green so that all of our providers can identify them and they'll be easily accessible. We also began a medical interpreter skills training program, and this is our largest to date, with 207 candidates participating from 28 facilities system-wide in 21 languages. Happy to also announce we are working with IT on Epic integration. And so what this means for language access is that we will be able to have a one-button connection to our interpreters, which for our patients will make it more accessible. We'll spend less time asking them their information with the interpreter, because that will all be fed through the computer. So once we connect all the information, it'll be one-button access to connect to an interpreter. So that's also speaking to the patient experience. In terms of Section 57 of the Affordable Care Act, the updates on civil rights and healthcare regulation, we successfully updated all notices on non-discrimination, language access, and effective communication for individuals with disabilities. Through on-site promotion, we also did printed material at each one of our facilities in 14 languages to ensure that all of our patient populations have equal opportunities to know the updates. We also updated the system-wide new employee orientation with the training on Section 1557 content as required for employee awareness. So we're focusing on patient and employee awareness with the new requirements. In terms of veteran support, happy to say that in this past calendar year, we had 200 participants participating in our veteran symposiums. Now, our veterans are self-reported, so we have a self-reported group of 289 individuals throughout the system that identify as veterans. With these new pop-ups that we're doing at each facility, what we allow them to do is get information on different programs that are available to our veterans. So for example, if we have employees that are working here that don't have their disability rating, these are things that we help them with. We partner with the Mayor's Office also for Veterans Affairs. We've had a Let's Talk Veterans webinar with 70 participants, We had a veterans fair with 20 exhibitors and 100 participants, and we had launch of internal veterans website, which has over 200 resources for our veteran population. As our employees are seeing this website with all the resources, one of the requests that we're receiving is actually to make it public for our communities so that our communities can also avail themselves of this information. Now, why is this important? Well, in terms of a recruitment tool, it's definitely for engagement for our employees. But in terms of a recruitment tool, whereas an employee veteran may be making a set salary, if they get a disability rating, this could mean the difference of an additional $1,000, $2,000 in their pockets every month. So again, speaking to worker equity throughout the system. In 2025, we are continuing to be veteran support focused initiatives with a goal of 2026 having New York City Health and Hospitals earn a veteran friendly designation for veteran populations. In terms of disability awareness, we started this initiative in 2023, and it's basically to increase awareness of disabled populations across our patients as well as our employees. We trained in the latter part of 2023 169 participants, and this is training employees on all types of awareness of disabilities, whether they're visual or non-visual. In 2024, we increased the number of sessions based on employee feedback, and we increased the number of participants to 312. And so one of the main feedbacks that we've received from an employee, I have a quote there, not knowing that someone has a disability by their looks and also being more sympathetic and understanding of persons with disabilities. So this is something that we receive, feedback we receive for our employees. In addition to that, we've also done a lot of community outreach. So we participated in the Disability Unite Festival on July 14th with 120 participants. And what we do at these festivals is not only do we reach out to our patients with all of the information, all of the services that New York City Health and Hospitals provides, but we also ask the patients what they would like to see from us in terms of services rendered so that we can better meet the community's needs. We also presented a screening of a CODA movie, which is a children of a deaf adult or child of deaf adult. We had 22 participants. We participated in the New York City Disability Parade. We also introduced adaptive yoga for our patients and our employees on December 3rd with a total of 9 participants. In terms of system levels on LGBTQ plus and equity, one of our goals and one of our focus areas is to increase recruitment of underrepresented populations. And one of the things we did is started to focus on LGBTQ as a start. So we partnered up with our HR talent acquisition teams and started looking at community-based organizations that were targeting this particular group. And so on October 9th, we attended the Queer in Every Career recruitment event. On November 12th, we attended the first annual Transgender, Nonconforming, and Non-Binary Job Fair. And these are, again, part of our talent acquisition strategy to increase recruitment of underrepresented groups. Also, good news in terms of our LGBTQ Long-Term Equality Index. Successfully in November 2024, our team submitted evidence for the 2025 Long-Term Care Equality Index, which is a joint project, basically from the Human Rights Campaign Foundation as well as SAGE. The LEI, or the Long-Term Care Equality Index, is really the nation's foremost benchmarking survey of residential long-term care and senior housing communities. And this is basically geared to communities and practices for our LGBTQ residents. And so it's making sure that we provide them with equitable care. A total of 2,861 staff out of 3,182 members actually completed the training that's required to get this designation. And it's also the Bill of Rights training for long-term care facility residents who are LGBTQ or living with HIV training. And what's actually even more notable about this is they did it in a period of 2 months.
Amazing.
Yeah.
It usually takes much longer for individuals to take the training. All PAC LTC facilities achieved over a 90% completion rate. This training also meets the requirements for the new Public Health Section, Law 2803. So by providing one training, we were able to target 2 different initiatives. The designation for our LEI designation will be announced in spring or summer of 2025. So we have met all the requirements, however, it's not published as of yet. In terms of worker equity, as of December 12, 2024, I'm happy to announce that we have saved employees over $9.5 million via our educational assistance and loan forgiveness programs. And so when you look at worker equity, these are employees that may have to pay $200, $300 for loan programs. And what we've done is we tried to consolidate all these loan forgiveness programs. And just to give you a real example of what this is, we had an employee that came to us approximately 3 years ago when we first started working on all of these programs. And the employee was very excited, walked into my office and said, my loan was forgiven. And this is going to be the difference between me owning or renting an apartment. And I'm happy to announce it couldn't have worked out better. We received a call this morning. The employee just closed on their home today. So very exciting news, and it's just nice to see that the work that we're doing, it may take years for it to make a difference, but it does make a difference. So this individual, I don't think will be leaving New York City Health and Hospitals. They're pretty invested in terms of our commitment to supporting our workforce. We also have another program, the Food Nutrition Worker Education Fund, which provides funding for educational opportunities targeted at staff in food and nutrition programs. In 2024, we funded 43,000, 5,000 across 48 employees system-wide. And this is an example of how we can support our employees in these titles and really fill the needs that we have throughout New York City Health and Hospitals. So we currently have students pursuing nursing degrees, we have students pursuing social work, and we have students pursuing pharmacy tech titles. And so this is all done with the funding for the Food and Nutrition Fund. In terms of communications and marketing, as a standard practice for our DEI, we acknowledge, we commemorate different observances throughout the year. And highlights, you can see that this is the listing from October through January, but different highlights where we did Transgender Awareness Month, we celebrated Native American Heritage Month, we did Day of Persons with Disabilities, we celebrated Italian, German, Hispanic, and Polish Heritage Months with different events at different hospitals. Also, in terms of informational, we have our Dr. Jimenez, the New York City Care Partner with the Consulate General of Mexico in New York, the Med Council and Multi-Ethnic Alliance of New York on healthcare access presentations. And this is really another effort at working with our communities and making healthcare a little bit more accessible and all the support services that they need as well. In addition to that, we had several awards. New York Health and Hospitals leaders recognized by Crain's New York Business amongst notable Black leaders, our own Seon Ajibade, Georges LeConte, and Cedric Oliveira, representing South Brooklyn, Harlem, and South Brooklyn Health, were celebrated by Crain's New York. And then we also received the silver recognition in the American Heart Association's Wellbeing Works Better scorecard. And this scorecard basically evaluates all the work that we're doing with our workforce in terms of health equity, burnout prevention, compensation, and benefits. And so we were awarded the silver recognition. Our goal for 2025 is also to go for the gold. And so we will be focusing on increased health equity and increased other areas that were identified as potentially having opportunities for improvement. And just in terms of the year ahead. So for 2025, we understand that the DEI landscape is rapidly changing and evolving. So we are going to start off the year by holding DEI employee voice sessions. These are opportunities for our employees to participate in anonymous programs where they can speak about all things DEI, as well as we're going to have facilitated leadership interviews to feel the landscape of where our employees, where our leadership feels we are in DEI topics. And as a result of that, we'll be able to obtain current state information, but also we will be better positioned to serve both our leadership, our employees throughout the system in all areas related to DEI. It will also inform our new and updated strategic plan in terms of where are the areas that we need to concentrate in.
Very good.
I will pause there for any questions.
Dr. Katz?
Yes.
Oh, go to Jackie first.
Oh, Jackie Rhodes?
Yes, this is a lot.
Yeah.
This is a lot, and it's a good lot. You know, the question is, you talk about employees and you talk about the resident, the patient.
Yes.
So do you recruit volunteers? Because I didn't hear that piece.
Oh, yes. So we have a robust volunteer recruitment center throughout this facilities. And so that's not part of this presentation, but I can absolutely add it to the next presentation. We have volunteer sites located through each of the hospitals, and we work with them on a regular basis. As a matter of fact, we have a volunteer council meeting coming up next week.
That's great, yeah, because I didn't hear the volunteer, and I know some volunteerism must be in there, and you're dealing with all the hospitals, and I see my favorite George Lacan on there, Lacan, and so keep up the good work.
Thank you.
Okay, thank you.
I have a minor question. Is the green iPads going to replace the thing on the roller for, I'm thinking especially for sign language, which is where it comes up the most, that someone is physically there and you need a visual?
We can definitely look at that with the implementation of the One Touch Epic. So we will have the ability to have the interpreter actually come on the computer monitor itself, or we will have the opportunity to kind of forward it to whatever system we want. So didn't have that specifically in the plan, but we can look at it.
Well, I don't know if it's better or not. It's just that, I mean, that's where it comes up clinically the most, right? Because in general, at least in the outpatient area, the voice translation in multiple languages works quite well, but obviously can't work with sign language, right? So then they always roll in the thing with the monitor, and it in part, at least where I work, I think it has to do with the Wi-Fi band sometimes is not sufficiently strong, and so it's hard to get as good, a connection as you want. And I didn't know if we would continue to use that or we would use the green iPads, because the person could appear in either place.
That is a good point. And so this is exactly what we want to hear. We're always looking to hear the voice of the customer. So things like this, usually what we do is we have meetings with our vendor. Every month we go over our key point indicators to make sure our connection time and things like that, and any issues that arise, we address. But we also have meetings with each of the language access coordinators. And usually what happens at a site, so let's say, for example, you work at a particular site, you're having an issue, the language access coordinator will be informed, and they would bring that up at our monthly language access coordinator meetings. And that's when we would know and we would approach it. Other than that, I also receive emails or I receive communications from different individuals if there are any issues that are arising, and then we focus on addressing those areas. So now that I know about that, we'll definitely be looking into it.
Okay, well, as long as we're on small issues to look, there's also the issue about the different kind of Arabic interpreters, right? That we don't have. Right now, at least the last time I needed it for a Wolof, it's African Arabic, but the Arabic interpreter could not do it, but she knew who could do it. But there was no system to get it directly. You have to call the Arabic interpreter, and then the Arabic interpreter, who is the wrong Arabic interpreter, connects you to the correct Arabic interpreter. So it was a question of could we, have that as a direct question, and now I'm blocking on what was the correct terminology for the type of Arabic interpreter that the person needed. But I'll have to think on that, and I'll send you an email. But right, there are many kinds of Arabic, is what was clear to me, right? And but you only on the phone you only have one choice, which is Arabic. But sometimes that the regular Arabic interpreter is not the right Arabic interpreter, and so you need I just can't think at the second what the correct terminology is, but I'll find it and send it to you.
Okay. I'll be standing by.
Karen St-Hilaire?
I happen to know this is a lot of work because I'm over DEI at DSS. So congratulations.
Thank you.
Job well done for the year.
Dr. McNabb?
Yeah, thank you so much. Yes, congratulations. It's such a rich amount of work, and this is my first meeting, so I might ask questions that folks already know the answers to, but I'm really impressed by the language interpretation efforts. And I, I didn't have particularly the question about Arabic, but questions about indigenous languages to West Africa and to South America. Wolof being one of them, but then also just recognition that we are often sometimes assuming that people might speak French because they're from a French-speaking West African country, but then that's actually not the first language. So just curious about the amount of indigenous languages in the choice of 14. Um, and then my second question was maybe a little bit broader for all of the DEI training, which is like, I can't even fathom how you accomplished, was it 80-something thousand people, which is really amazing. Um, I My question was a little bit more on measurement of impact. So how, once you measure sort of how many people have taken, which trainings they've taken, how do you know what impact that's having on the workplace? Are there measures that help you determine those things? Those are my two questions.
Sure. So I'll start with the first one in terms of the indigenous languages. So we track and we trend every single facility, and so we are very well aware of what are the top languages, right? And sometimes they do fluctuate. So as soon as, let's say, for example, if there's an indigenous language that's coming up in terms of frequency being used, then we actually start putting that into our DIS. We have a website also that looks at every single facility and what are the top languages there. And so we're able to see what's the commonality, what's the frequency of them being asked. In terms of kind of diving down and when individuals call and trying to identify what is that. So again, we're working with facilities in terms of when they reach, let's say, for example, in your example, when they reach a particular dialect or language, in getting in touch with our vendor provider and seeing, okay, what is the best way to kind of drill down? And I think that builds on Dr. Katz's question to kind of let's solidify what are the top languages that are happening or dialects that are happening within the African and Arabic dialects and languages themselves, so that we can be a little bit more clearer and make it easier. So as a physician, you would want to know if these languages are coming up frequently, let's just press 3 and make it a little bit.
And I can now build on your question. So it's Sudanese.
Ah,
So the issue is that right now, I can't ask for a Sudanese Arabic interpreter, but I can call the Arabic interpreter and say, could you please get me the Sudanese speaking Arabic interpreter? And they can do that. But it seemed like, well, okay, now that I've learned this, right, I shouldn't have to, make them go through that. I should be able, so I tried every version, Sudanese, Sudanese Arabic, Arabic Sudanese, but none of them were understandable. So then I go back Arabic, and then the Arabic interpreter says, oh yes, you need the Sudanese Arabic interpreter, and gets them. So that was thank you for helping to prompt my memory.
I actually have a clarifying question for you.
Yeah.
How long did that take?
It took a while.
Right.
Right.
So
Well,
for
first,
that-
right, in the beauty of diversity, it took a while for, I got it, the Epic says Arabic, so I get the Arabic interpreter, and my patient and the interpreter attempt to talk, and it took them a while to figure out that they didn't understand each other. And then the interpreter said to me, he doesn't understand what I'm saying. Where is he from? Then I looked up in the Epic record and found that he was from the Sudan. Told her that, and she said, oh yes, you need the Sudanese. And she was able pretty quickly to get it. It was then when I had the next visit, and I felt like, oh, now I'm so smart, I know to ask for the Sudanese Arabic, that I discovered, no, I can't. There's their AI doesn't understand Sudanese Arabic. And so I had to start again with the Arabic, right? To your question, especially, and this is, I think, a credit to Ivy, and I don't know if you've had the same positive experience, the response times are much better. You can get, in my experience, they're on like in 5 seconds, right? If you put in you say it and the thing understands, at least, that's been my experience for Mandarin, for Cantonese, for French and Bengali are the ones that I've recently used. And all of those were very fast.
That's great to hear.
Amazing, yeah.
But you had a second half of the question.
Oh, no worries. Yes, it was more so on just like, kudos to the amount of training and just curious um, how you measure impact or what measures you might be using beyond the numbers of people trained and how that influences like the work environment.
So very timely because I was just having this conversation with the team this morning. So when you first start off on training impacts, you look at a level one, right, which is how many people are being trained. Then you like to move on to level two. Well, they were trained, what did they learn? So to do that, we do pre and post. So we like to look at what was the objective of the training, especially when it comes to e-learning. We like to do a lot of embedded exams, kind of measure pre and post. Where we are starting to really focus on is a level three, which is behavioral change. The issue with establishing behavioral change for this number of trainings is that it's very labor intensive. So for example, some of the things that we're doing with other trainings, if let's say, for example, we do managerial training. And so then we would go back 3, 6 months later and follow up with the manager's manager and see, well, did you improve, did you see improved behavior? Did you see changes? But that is very labor intensive and resource intensive. So we're still kind of trying to look at ways in which we can focus on how do we really measure impact.
Yes, yes, that's really great. Thank you so much. And I might have one more that's just like a factual question. The iPads you described, are they also in the Gotham, the locations?
System wide.
Amazing. Yeah, that's great. Thank you so much. Congrats.
Thank you.
So again, congratulations to you and your team. I noticed some of the metrics and some of the numbers. The participants have double or exceeded that number. So that's a lot of work, and I'm happy you're moving on to looking at other aspects of the work that you're doing. Congratulations, and I know this is only a year for me, with you, right? And I've seen a lot improve, a lot more participation, and I look forward to your growth and sustainability and making a difference in the system with people feeling that they're coming to work in a place that's very inclusive and works very hard to represent their needs. So thank you.
Thank you. Thank you, everyone.
Yes, thank you.
And now I'd like to turn it over to Dr. Davis, so we'll be presenting from our equity and access, our workforce diversity.
Great. Good afternoon, everyone.
Good afternoon.
So as you know, Equity and Access Council has several work groups, and today we're going to be focused on the workforce diversity work group. Next slide, please. So I'd like to introduce, we're going to be talking about Mosaic, which is our Visiting Scholars Program. Mosaic stands for Medical Opportunities for Students and aspiring.
Aspiring inclusive clinicians.
Thank you, thank you. And I'm going to introduce Dr. Tia Balai, who is going to speak about one aspect of the Mosaic program, and then I'll be speaking about another aspect of it. Dr. Balai?
Thank you. Yes, so like Dr. Davis said, Mosaic stands for Medical Opportunities for Students and Aspiring Inclusive Clinicians. It's a suite of interventions that help students and trainees from underrepresented backgrounds succeed in medical school and beyond, and I would say before medical school as well, as far as what we've decided to focus on. Our goals are to create a pool of competitive candidates going into medicine, build necessary skills and training beginning early, recruit these students into medical school and beyond, expand the NYC Health and Hospitals physician workforce, and expose middle school and high school students to careers in medicine, and that's through the partnership with Mentoring in Medicine. Next slide, please. So the part of Mosaic that I'm going to be talking about today is the Visiting Scholars Program. This is the opportunity for medical students in their 4th year of medical school to come to NYC Health and Hospitals and do a 4-week elective in the specialty of their choice at one of the facilities in our system. Students can specify a borough preference, and we match to the best of our abilities to that. So the students that are eligible are medical students attending U.S. accredited allopathic medical schools, and we encourage students from underrepresented backgrounds to apply. Like I said, it's a 4-week program. Students receive a $2,000 stipend for the rotation, and students that are coming to New York City from outside of the NYC metro area receive an additional $2,000 housing stipend for their time with us. And we hope during their 4 weeks with us, they have opportunities for shadowing, didactic sessions, practical learning, simulation, and experiential training. For this last cohort, this last year, students submitted applications, their CV and resumes, official transcripts, personal statements, and letters of recommendations. Those were due in April of 2024. In May, decisions were sent out to students, and then they were then matched with H&H at H&H facilities based on their elective request and, like I said, their borough preference. So this year, for our cohort of 2024 and 2025, I just wanted to highlight a couple of our key accomplishments. So we had accepted 20 medical students into the current cohort for this academic year. We had students from the CUNY School of Medicine here in New York City, as well as Morehouse and Oregon Health and Sciences University. These students rotated at a variety of facilities, including Bellevue, Elmhurst, Jacoby, Lincoln, Metropolitan, Queens, and South Brooklyn, in a variety of specialties. This takes a lot of coordination and partnership with our facilities and their respective GME programs to have these students matched, but we have found that most facilities and programs are more than enthusiastic to host these students, and we've gotten great feedback from students and the facilities about the partnership. I wanted to highlight last year in the 2023-24 cohort, we had 11 students participate, and 2 of those students ended up in our system doing residency after the match last year. So we have 1 student doing OBGYN at Lincoln Hospital and another student doing an ER residency at SUNY Downstate Kings County. So we're very happy with that. One of the new aspects of the Visiting Scholars Program that we introduced this year is the Health Equity Curriculum. So this is a weekly didactic series with me. We have a variety of guest speakers come and speak with the students, touching on topics such as social determinants of health, population health, and racial bias in healthcare inequity. This curriculum is supported by the American Medical Association Health Equity Curriculum. And so in the final week of their rotation, they choose a specific AMA Health Equity module to review and present on that supplemented their clinical experience, and they have the opportunity to present to our Mosaic faculties. Next slide, please. So I just wanted to highlight a couple of the student presentations because they were very impressive. So we have students talking about adverse childhood experiences, the maternal mortality crisis, social determinants of health, and mental health in Hispanic and Latinx communities. This year, we also started collecting information about, we started collecting feedback through a survey of the Visiting Scholars Program. So we were excited to see that 100% of the students who had completed the survey, so I'll give some numbers. We've had 16 students so far of the 20 that were accepted. We still have 4 more that will be participating in the spring. 11 of those 16 have filled out the survey. So 100% of those responded strongly agree or agree to say that they're motivated to learn more about health equity and committed to addressing disparities in their future careers after their experience at H&H. 90% were very satisfied or satisfied with their overall elective experience, and 90% would recommend this elective to their peers. This is actually the 3 students from our first class of Visiting Scholars Program, so that would be the 2022-2023 cohort. We like to collect quotes from all of our rotators just to highlight their experiences, and I wanted to highlight these 3 as well as we think about how we will continue to utilize the Visiting Scholars Program to increase the diversity of our physician workforce. So these students are now in their 2nd year of residency, so trying to maintain a partnership with them, exposing them to opportunities at H&H, including the loan repayment strategies that was discussed earlier as ways to attract them back to H&H. So we're very excited about how Mosaic is going to continue to grow, and I'm happy to take any questions about the program.
Thank you. So, Dr. Katz?
No, but, we reached agreement with Doctors Council, and so, over the weekend, and so also our physician salaries will be more competitive, which I hope will also make a difference in terms of people, especially if people have large loans,
Right.
feeling that they, really can, focus on their passion without compromising their ability to pay the rent.
Definitely.
Jackie Rowe Adams? Karen St-Hilaire and Dr. McNabb.
Sure, thank you so much. That pay equity was on my list of questions, which if that's not for today, happy to sort of delay, but congratulations. And also really nice to hear the health equity module, and having clinicians learn early in their career, learning about what their role is in health outcomes in the neighborhoods that they serve. So thank you for that. I think the only question you answered in part are in relationship to the loan forgiveness, so that sounds really great, and then some of the pay equity work. I guess the only other question I had, it might be a combination of the two presentations, but have you seen a change in like the numbers or the types of complaints that like Black and Indigenous and Latino staff share about the workplace and workspace? Like, has that improved, or both, I think, in the way that you're investing in kind of young clinicians or early clinicians, and then you're also investing in staff and clinicians who have been on site for a long time. And so maybe a mix of both presentations, but curious how all of this is perhaps changing what's happening to BIPOC staff and clinicians within the space.
So I can speak personally on my end. So we receive emails whenever someone is not happy about anything. We'll receive an email basically letting us know. And so as of late, the number has decreased. I don't have exact numbers because again, all of the complaints don't necessarily come via my office, but I can tell you there has been a marked decrease in the number of emails or calls that I get from staff complaining.
Thank you for that.
And, I said this to you before, I love the fact that we went from 11 to 20 in this cohort, and I look forward to that number increasing, and then increasing the number of people who actually does decide to make H&H their new home, because to me, that's the reason you're doing all of this. And also looking at funding streams to make sure that we're paying for people to travel here, if that's the case, removing all barriers that, people that of the different minority persuasions and backgrounds might have on a day-to-day basis, not being able to afford to participate in a program like this. Even though we're paying some of it, it's still not all of it, and if we can do all of it, we should. We should do it, and I know we had that conversation, but I just want to repeat it for the record. For the record, yes. Thank you. Great job.
And so moving to our younger students, so we also really wanted to invest in even younger students, right? Because we know that we have to try to start early to build that pathway for them to even get into medical school. And so we felt like we really had a lot of strengths in order to bring medical students in, but we thought to get to the younger students, that really wasn't our strength. But we do have partners that have been doing excellent work at this for many, many years. So we opted to partner with Mentoring in Medicine. Mentoring in Medicine is a program that has been really empowering students, parents, and educators since 2008. I've had the pleasure of volunteering with them many years ago, so really thought about them as potential partners when we were looking to figure out how to engage younger students. So they've guided many underrepresented minority students to achieve their dreams of becoming physicians and addressing critical disparities in the workforce. Next slide, please. So they've done several programs. So from November 2023 to April 2024, they've done a medical pathway program. These are pre-medical students, and they will take recent college graduates, and they attend a 20-week boot camp that prepares them to take the MCAT, review medical school applications that are, those applications are reviewed by volunteer providers. Some of them are our providers, and really improve their interview skills. So 31 students in the current cycle. We have 31 students that are in the current application cycle, and they usually have about a 90% acceptance rate, which is really phenomenal. Next slide, please. So this is their hospital youth academy, which reaches middle school students. And so we did this one in partnership with Harlem Hospital. This was done in March, and we had, this was one of the rainiest days. And I showed up and I was just like, there's no one that's gonna be here. I showed up, it was packed with students, parents, staff, and we had it at a school that was really adjoining Harlem Hospital. And the students were so excited. They really learned how to build a model of a digestive system there. And they're really learning about what medicine is like through a health science career panel that many of our physicians participated in, our Harlem Hospital physicians participated in, and they attended an interactive science fair. So really fun day for the students, really great way of engaging them. Next slide. And Mentoring in Medicine also does several high school science fairs where they've reached about 1,500 students, hosting these science fairs across 10 different high schools. And students, they have the opportunity to learn different things like how to use a stethoscope, suture wounds, examine animal organs, and simulate blood draws. So again, really just making it exciting for younger students to be thinking about a career in medicine. Next slide. They've also done a biomedical hackathon, which has been virtual online, where the students spend time reviewing scientific publications and developing public service campaigns, and they're mentored by physicians that are usually engaged with them. And again, some of these physicians are ours that volunteer to do this work. Next slide. One of their newer projects that they're working on is creating books where they will have students write a book about a visit to a hospital. So it's a children's book about a trip to the hospital, and it will be reviewed by providers again to try to give it a little bit more of a factual take on a hospital visit. And again, it's really just another creative way of introducing younger students to a career in the health career field. Next slide. I think that might be the last. So that really is some of our work across the spectrum of students in Mosaic, from the youngest students in elementary school up until pre-medical school, medical school, and engaging them. So I think that's really demonstrating how we're aiming to build that pathway of students who are interested in medicine.
Thank you, Dr. Davis. Jackie Rowe-Adams, any questions for comments?
The comment is wonderful. You know, years ago, I guess go back 30 years, almost 40, because I've been with Health and Hospital for a long time, with the Renaissance, connected with Harlem Hospital, and the CPS 197. You know, that is great. They had school-based clinics years ago, but it stopped. And I'm so glad to see that it's back, but in a different light. It's more, fashionable now. And I'm loving it. So how many schools do you have?
So Mentoring in Medicine partners with different schools in each borough. So they're going to be and they're trying to partner with schools that are close to our hospitals.
Right.
So they're working on partnering with some schools that are next to Lincoln. They have a host of schools that they work with for the science fairs as well. So they've gone to like 18 different high schools, and now they're working with some of the middle schools. So yeah, they have several schools that they work with in all the boroughs.
That really is excellent. And the messaging is how do it get out there to the community?
Well, they do a lot of recruitment to get the students in, and the students come because they do things like give away PlayStations, and that attracts a lot of students when they have like a free giveaway, things like that. So So some of it is like for those weekend activities, they do draws like that to get the students in. And then other things are being done at the school during school time that they've worked on with the teachers. So they will come in as part of the curriculum.
Very good. Thank you. Keep up the good work. Yes, yes.
Dr. Katz?
I think it's great. I like the idea that you didn't try to reinvent the wheel. That, right, because it wouldn't, we would not have been the right group to do that. Right, and so very smart to partner with someone to do it.
Excellent.
Karen Senhiller?
I think it's awesome work. I think it's awesome work. I think the joy for me was watching the little girl. Were you looking at that with the smock on?
Right.
And it looked like a little girl, but it was
Right.
actually the organs.
Right, yes,
But at
yes,
first glance, it looks like a person.
right.
This is just great.
Also a lovely picture of Nicola on the previous one. Did you see her?
Yes.
Yes.
Yeah.
Excellent, yeah.
Dr. McNabb?
Yeah, no questions. Congratulations.
Excellent work. You know how I feel. I think, I just want to see more of it. So I'm looking forward to your next report. Thank you. Elise, did you want to speak on the calendar? Did you
Yes.
mention?
Oh, so happy New Year
Sorry.
to everyone.
Yeah.
As is customary, we're starting the year, first season with our calendar. Every year we have a different theme. This year we're focusing on the power of collaboration, and it's really recognizing that DEI is not just an office. DEI, in order to be in its true sense, should be embedded in every aspect of the hospital system, and we don't do that alone. So it's really a nod to all of our partners and the work that we're getting done. As you can see, this is a large volume of work. We rely heavily on all of our colleagues to get it done. So, thank you.
It's a lovely calendar.
Thank you. Thank
I have
you.
it on my
It is.
desk.
Thank you. Any old business? Any new business? There being no further discussion, meeting adjourned. Thank you.
Thank you.
This meeting is no longer being recorded.